Thank you, Dan. We have the perspective of the agencies, the managed long-term care provider, the government, and the policy wonks, and a premier policy wonk in Secretary Burke, and from the primary care perspective. So that leaves a lot of food for thought. I'm sure many of you have questions. We'll take the next 10 minutes to do some Q&A before we have our closing remarks, after which we'd like to invite you to a networking lunch, so I hope that you'd stay around. So we're going to start with questions, at least for 10 minutes. Is there a microphone? Okay.
Hi, Igal Jelinek, CSCS. I just want to echo what Catherine said earlier, and one of the strengths and weaknesses of the aging network is we need to build the infrastructure, especially the IT infrastructure, to play in this game and play in this world. And what happens is that we're seeing, and through a grant we received from Samuel's Foundation, there were two major things that happened, and maybe it's changed. People didn't know the cost of their services, full cost of their services, and they're not used to negotiating those rates. Those two skill sets need to be developed over time, plus an infusion of dollars on the technology side, which you raised. Because you're dealing with 31, how many did you say? I thought it was 23, but 30. 23 FIDA, 20. You then have to have contracts with a lot of these. So the question is, can you participate in this process? That's my question to you. And I saw that senior centers weren't listed on the Emblem Health piece, which we talked about earlier. But can the aging network play in this game? And what size do you have to be to play in this game and to have the venture capital? So if there's no infusion of dollars for infrastructure, and you haven't been in the Medicare game before, how do you then transform yourself to be a partner in this game? And so if there's incentives that could be put out there that incentivize the system with an infusion of dollars for people to partner. One example I'll just throw out, a year ago or 2 years ago, we do a conference, and we had the head of a hospital, and we had, who's now the Deputy Mayor of Health and Human Services, Lillian, have a dialogue and communication. And it was how hard it was for the different worlds to communicate in terms of language, because we come from different worlds, and we see that social services and health services are coming together. So my question is, from the state perspective, which is the train is moving fast, and it's a good thing, how do we make sure we're on it, and that we continue to run with you on it? And what can you incentivize for this particular system to be able to participate in that game and in that playing field? And so forth. And I really appreciate having the Medicaid information for the senior programs. That could really open up some dollars as well. But I think those are some of the struggles that we've seen at the Council of Senior Centers and Services. And then the other piece that we've seen is people sign contracts with MLTCs and there's no referrals. Okay, so we know a program in Staten Island that's Meals on Wheels, who got up and spoke that he's had contracts for many years, and he's had like 50 referrals. So if there's such a need for these home-delivered meals, social daycare, adult daycare, bill-paying programs, you name the services that might not even exist yet, how do you ensure that referrals come back to the community with reimbursement dollars? I threw a lot on the pieces, but I think what you have here in this audience, I think you have a lot of people who want to participate, and they're trying to figure out how can we participate when we haven't invested in the resources to help us participate. And I'll give you one example. When the BIP grant was put out, there were only 70 applications, what I understand, statewide for $45 million of innovation dollars for those who applied. It's a good thing, I guess. But it tells you a story that people haven't developed partnerships, at least in some parts of the state, to go after this kind of money. So I sort of throw this out there to you, and these are the challenges that I think we're all facing in the community, and the transformation that Catherine talked about with her board. I still don't know what a buggy whip is, but that's okay. But I think there's a transformation going on in our sector that's moving very fast in the healthcare sector, and when they're coming together, some folks are there, but most of us aren't. So the question is, what can you do to help us get there? Thank you.
Well, that's a lot of great questions. Let me see if I can try and answer some of them. You started with a question about infrastructure, information technology investments. There may be some opportunities in BIP, but I think that that's probably, of the things you mentioned, that may be the most difficult one. However, if you are of value to another bigger partner who has already made those investments, and Catherine alluded to some of the investments the state previously made through the Health Affordability Accountability Law HEAL dollars, they would want to make the investments in you. But it's about finding where your strengths lie. I know in the experience of the disability providers and working with managed long-term care, they said, we're really good at the care coordination piece, but we're not good at the billing piece and these other pieces. So that's why they have come together with the managed long-term care plans and the DD providers, because DD, they know the people, they know what services they need, they know how to best meet those needs. Managed long-term care doesn't have as much experience necessarily serving a special population, but they can bring all of the back office services and the billing and the IT. So you've got to show what it is that you offer that is important. Interesting comment about the referrals. That's not something I had heard yet. But we do plan at the state level to have a meeting, I don't know when it's scheduled, but it's soon, between my office, the Health Plan Association, the Department of Health, and the State Office for Aging to talk about how can we do a better job and what other things can we be doing to make sure that the aging providers are part of these networks going forward. So we are very open to hearing your thoughts and suggestions. We've been getting some of those ideas through the State Office for Aging, but this is something that we're trying to make sure happens, because you really are a great resource, and you are an attractive partner because you know the people better, you know the outcomes, and you are less expensive.
I think, one of the advantages of being a little bit later to the game is that, there are a lot of lessons learned from managed long-term care and other special populations that have been going through this. And I know at the Department for the Aging, we're investing in technology around case management and senior centers, and as that information gets entered and we have better data, there are ways to cross with managed long-term care providers in terms of bridging that technology and that information, because one way to have an integrated service system is, of course, if your technology speaks to each other, and that's an important piece. But in the mental health world, they've been doing this. Remember PDS over at DIFTA? I mean, that was one of the first databases and electronic information systems of any city agency. So we've evolved since then, and we have better technology. And many hospitals, as you know, they have huge grants from the government over a number of years to retool and develop some of this technology. And as we roll it out in other service sectors, there are many, many problems and many issues, and you have to get one system to talk to another system. They're not always compatible, so you have a third system. So thankfully, all of those growing pains, they'll be done, and maybe we can piggyback off of some of the lessons that they've learned. But certainly the aging network provider, it's a very good point. We need to be working with the State Office for the Aging and the Department for the Aging, really taking the lead on how some of those service systems are integrated. Thank you.
Hi, I'm Nancy Miller. I'm the CEO of Vision Services for the Blind and Visually Impaired. Two comments. Many of us have relied on either DIFTA itself or the Council of Senior Centers for training. What we're being trained on doesn't cover the new skills that we need. We really haven't had a training on the difference between outreach and marketing, and bringing in the resources of marketing experts for ourselves and our staff for those agencies that don't have a marketing department, don't have an advertising budget. The second thing, and I totally agree with the idea of partnerships, and many of us in the room partner in a variety of ways, but the government, and DIFTA in particular, I believe, can be the structure for those partnerships. And I'll just give an example from the old OMRDD before it became OPWDD. What that state agency did is help smaller providers that wanted to provide family support services for people with disabilities and developmental disabilities. Basically, we just gave all the information to the state agency. They did all the billing. They did all of the verification. When the system changed, the smaller providers couldn't come up with the capital to create the infrastructure for the small amount of the contract. So it would have cost Visions $75,000 to $80,000 to hire a Medicaid billing company when our entire contract was only $75,000. Again, the role that government plays for the smaller providers, I think, looks very different than the role government plays for pulling together the larger ones. And I would just ask you to look at how to involve us in a way that enables us to keep the closeness to our client and our neighborhood and our community for those of us that are smaller, but still take advantage of the opportunities, because all of us together are the underpinning of what makes the system so strong. So we really do look to DIFTA and to the city for figuring out ways, in the same way we've come up with marketplace buying so that we have buying cooperatives. There should be systems established through government that help us move to the next level. Thanks.
I was waiting for the people with acronyms to speak first, but I'm acronym-less. I think what qualifies me to be here is that I had a father who just passed in November '96 and thanked me for keeping him alive so long. I take some credit for that, but I must say the last 3 years he did spend in a nursing home. And while I'm proud to have been a caregiver and to be described as the backbone of a broken healthcare system, little extreme maybe, but I was there for him. And at the point that you do put them in a home, you do feel as if you failed, because the whole goal was to keep them at home. But his apartment building turned into a transitional housing facility for the homeless. So he had social issues all sort of coagulating, and I had to intervene. I had to show up at community board meetings to fight for his apartment. I had to call all of you at one time or another, probably heard me on your call list, was my point. So some of the details, once he got into the nursing home, I diagnosed that he had an aneurysm while he was living at home and got that taken care of. So the worst thing you think about when you have an aging parent is, am I going to open that door and find them in a pool of their blood for how many hours? We don't know. I was just there yesterday. You deal with all of this stress. And this is a man that never felt entitled. He was part of the depression, and so he didn't want to ever bother anyone. But the fact is, once he got in the home, he did fall. And so my point is pertaining to the home. I can use my phone and get a restaurant and directions in 3 seconds. In the home, I find the nurses completely burdened by paperwork so that they are hardly spending any quality time with the patients, with the residents. So my father fell, and another weakness I found in the home was the training of the CNAs, and how they're kind of almost looked down upon in some cases, because, you know, they're doing, the work that family is like, oh, God, thank God, I don't have to take my father to be toileted. Somebody else is going to do that. That's the biggest relief in the world. But the fact is that I found that he fell because once he was finished being toileted, he rang, had mild dementia, forgot he was waiting for someone to come, and instead of waiting outside the door for him to be finished, they had gone off to do something else. Other CNAs said, oh, I never would have done that. So again, the training, the evenness in training, why do some work better than others? There are also the people that see their bodies intimately and can actually report back to the nurses that they saw a rash or an infection starting. I had this experience also. So my point is, what is my point? Well, obviously, I spent 10 years as a caregiver, and it was very, very, very stressful. But I do thank all the agencies here for senior centers. That was a godsend at one point. And I also commend the healthcare system because despite the fact that we criticize it so much, my father spent 1 month, almost $1 million, trying to save him the month before he died. And that is something I know that we are all very concerned about, the amount of the Medicare funds that get eaten up in the last couple of years of life. That's a pretty humanistic system. And that's all I have to say. Thank you very much. My name is Geraldine Salvatorelli. My father's Italian. That made my whole caregiver job a little more challenging. Thank you.
Thank you, Geraldine, and I think that brings two important points that you made. One is how do we support the long-term care workforce, that how do we provide training, and how do we even recruit people into this industry that will only be growing and growing in the future. And secondly, we need to tackle the whole end-of-life issue, and not only from an economic perspective, but certainly from a human perspective. So thank you for bringing that to our attention.